Alex will be sharing with us a national picture for creative health, the challenges and opportunities ahead to support creative health to thrive across the town county and in Dorset. Thank you.
Thank you very much, Rosie, and thank you very much for inviting me here today. As some of you will know, this is my old stamping ground. I was arts coordinator at Dorset County Hospital for 15 years, and that's where I started my arts and health career. So it's really lovely to be back. I then moved to Arts and Health South West and am director of that organisation, which is a regional networking organisation, and now director of the National Centre for Creative Health, which I'll explain in a minute. So, so just to give you a little bit of overview around the infrastructure development in the UK, many of you may be aware of the Culture, Health and Wellbeing Alliance, which was set up in 2018 and supports the practitioners and the provider organisations primarily, has a membership of around 6,000 people, I think, at the moment, and is funded by Arts Council England. And they have regular meetups with Wales Arts, Health and Wellbeing Network, Arts, Culture, Health, Wellbeing Scotland and Arts Care Northern Ireland. Arts Care is actually a delivery organisation, but they're currently developing a network in Northern Ireland as well. And then the All-Party Parliamentary Group on Arts, Health and Wellbeing, a cross-party special interest group, was set up in 2014 and conducted a 2-year inquiry from 2015 to 2017 on the arts, health and wellbeing, and the report, Creative Health, was published in 2017 with 10 recommendations. Next slide, please. So recommendation 1 was for a national strategic centre, and that became a charity in July 2020, and we launched it in March 2021. And the mission is to advance good practice and research, inform policy and promote collaboration, helping foster the conditions for creative health to be integral to health and social care and wider systems. So it's interesting that Gemma focused on this idea of fostering the right conditions for this work to flourish, and that is very much where our focus is. So we're not quite 3 years old, so it's very early days for the National Centre. But as you can see from our mission, our focus is on systems, and we work very closely with the Culture, Health and Wellbeing Alliance, which is more focused on providers and practitioners. Next slide, please. This is a page from our website, and we call hubs, our systems and places work we call hubs, and we worked with NHS England and 4 integrated care systems, Gloucestershire, West Yorkshire, Shropshire, Telford and Wrekin, and Suffolk and North East Essex, to look at this issue of how to embed creative health at a systems level. And from that, we've developed a toolkit, which I'll show you a couple of slides about in a second, and that we hope will help support integrated care systems across the country, so including Dorset, to make the most of the opportunities for creative health. And then more recently, with the support of Arts Council England, we've launched our Creative Health Associates programme. Next slide, please. And that places 7 creative health associates in integrated care boards in the 7 NHS regions, and Penny Calvert, who's here today and is going to be speaking soon, is the South West Creative Health Associate based in Devon ICB, and I think I'm right in saying she is hosted by the Health Inequalities team, and it's been very interesting to see where the Creative Health Associates are placed within the system, where this work is seen as most useful. Penny will explain more about what they're doing and what she's doing, I'm sure. But you can see there the different ICBs that the associates are in. Next slide, please. On our website, there's also a map which shows the various programmes, including where the associates are. Where we have Creative Health Champions, these are senior leaders. It's a network of senior leaders in systems, and that's a growing network, and we're always encouraging people to think about whether they know a senior leader who would be willing to join that network. They support each other and we learn from each other. And we have a partnership around research called the Mobilising Community Assets to Tackle Health Inequalities programme, which is funded by UKRI, the UK Research Council, and particularly through Arts and Humanities Research Council. So the little example popped up here is a local one, Scaling Up Human Henge. Some of you may have been aware of that, led by Bournemouth University. They were a phase 1 programme. We're now into phase 3, which is going to be announced in a matter of weeks. And that will involve 12 projects across the country for 3 years with an investment of 20 million. So they're it's quite a big piece of research work going on. And next slide, please. Most recently, we've been working on a Creative Health review. I mentioned the Creative Health report, which was published in 2017, and recommendation 2 in that report was for a cross-government strategy, which there has been very little movement on. So we decided to focus on that in a year-long review, looking at how to encourage that idea of a cross-government strategy, so policy right at the top level. Next slide, please. And we were helped by a group of commissioners and a group of people with lived experience. So there was a series of roundtables, and each of the roundtables had speakers from across the different areas, such as research, policy, practice, and always somebody with lived experience of a particular condition that was relevant to the theme of that roundtable. And those people with lived experience came together in a group to support us through the process of the review, to support the commissioners, and to help us look at the whole recommendation issue. If we could have the next slide. In the back cover of the report, you see more of those commissioners, including ones you may have heard of, like Professor Sir Michael Marmot, Darren Henley, who's Chief Executive of Arts Council England, Monty Don, he was everyone's favourite, and also more of the people with lived experience who helped us. Next slide, please. So the review was structured around these themes. So you can see there in the contents page, the themes were creative health and mental health and well-being, health inequalities, creativity for health and well-being in the education system, creative health in social care, end-of-life care and bereavement, and then 2 themes which were more around the systems questions, cost and value, the economics of creative health, and leadership and strategy. Next slide, please. So obviously at a top level, the recommendations are to government, but I hope that the review will also provide everyone in the room and many others with useful information. So even though the recommendations are at a policy level, they're also to metro mayors. Next slide, please. There's a lot of information in there that I think you can find useful in making the case from wherever you come from. So you can see there on the left a quote from the WHO around arts interventions being low risk, highly cost effective, integrated and holistic treatment options for complex health challenges to which there are no current solutions. And I think that's a really key point in this work, is that we are really trying to help in situations where actually a more medical model perhaps, or a more traditional cure model is not actually appropriate because of the complexity of people's health and lives. And there are lots of opportunities for both sides, as Gemma outlined earlier. On the right there is an infographic, which I think is also hopefully quite useful, which has a focus on prevention. So this notion of being able to prevent at every level of need. So primary prevention before people come into health services, secondary and tertiary prevention when they're in health services, but even then you can help prevent their conditions getting worse. And then that it is usable and appropriate, and there are many examples across the life course from pregnancy and birth through to death. So there is a lot of material in here. It's not as big as the original Creative Health report, if any of you have a copy of that. I'm afraid we don't have loads of printed copies this time, but hopefully the online version, which is one of those easy read versions, is very accessible. Next slide, please. It also contains many case studies, relatively short. This is probably a sort of average length of a case study. This one is branching out, one of the research projects in that partnership with UKRI, and it's about working with children and schools around mental health and prevention. In its sort of more expanded version, it was particularly targeting schools in deprived areas, and across Cambridgeshire and Peterborough, I think since 2015, about 7,700 people have been involved in the Branching Out programme. But I'll just read the quote, which you can see there from a head teacher. Providing time and space early on for children to reconnect or connect for the first time with nature and art is the actual medicine that's required. Giving children a fresh start with the adults seeing them anew with talents that were previously under the surface is huge. Think of what could be achieved if more children worked with CCI, which is Cambridge Curiosity and Imagination. And think of the money that would potentially be saved in staff time, paediatrician referrals, expensive therapy. The key thing there is that it's leadership that really makes a difference in this space, and that is a head teacher who has implemented a session a week for every single child in her school in outdoors using creativity in nature. And it is possible, but we know that it is hugely challenging for many schools to find that time and space in the curriculum, but it is possible, and leadership is key. So that's a research programme, so of course it includes quite a lot of evidence which might be useful, again, for specific programmes that any of you might be involved in. Next slide, please. And then just lastly to talk a bit about the Creative Health Toolkit, another tool which I hope you'll find useful as you progress in Dorset with this work. I mentioned it earlier. It's structured around in systems, in context and in action. It came out of that work with 4 systems, so it is quite health systems facing in terms of the language, the structure, the way we approached it. But it has a lot of illustrative examples, so it gives sort of, it's quite, very short, not a lot of text, although the subject is absolutely massive. Next slide, please. So in systems, for instance, there's a focus on leadership and strategy as one of the areas of that. And you can see there are examples of strategy development. Gloucestershire is the example there, and Suffolk. And Greater Manchester has a creative health strategy. West Yorkshire has a strategy, and then examples of leadership, often about posts, which is one of the reasons why we arrived at the Creative Health Associates programme, because having people in the system is absolutely crucial. And then an example of the champions. Next slide, please. And then if you're more interested in the work itself in the context of health challenges, there are a lot of different sections around that. And for instance, health inequalities is an example here. And there are bite-sized examples, literally 3 lines with links to different examples of work that is being done with those particular groups amongst the health inequality groups. And we really want the toolkit to be iterative, so there is an option when you look at any of these examples to submit your own examples, and we would like to grow the example base. So that's it from me. Last slide, just some links there to explore that further, and obviously I'm going to be here all day, so if you have any questions, please do ask me in the breaks.